Hello and welcome to this Friday weekly webinar. Today to talk about yoga techniques and their clinical applications, we have with us Dr. Aashish Phadke sir, who is Ayurveda and Yoga consultant and Honorable Deputy Director KHS MRC विलेपार्ले मुंबई महाराष्ट्र. आपका बहुत बहुत स्वागत है सर इस कार्यक्रम में. We also have with us Director of Morarji Desai National Institute of Yoga, Dr. Ishwar V. Basavaraddi sir with us. आपका भी बहुत बहुत स्वागत है सर इस कार्यक्रम में. हमारा सौभाग्य है कि आप हमारे बीच आज इतने समय के बाद मौजूद हैं सर. बहुत बहुत स्वागत सर आपका. जैसा कि हमारे संस्थान की परंपरा है, हम किसी भी कार्यक्रम की शुरुआत प्रार्थना के साथ करते हैं. तो आइए प्रार्थना से कार्यक्रम की शुरुआत करें. ॐ सहना भवतु सहनौ भुनक्तु सह वीर्यं करवावहै तेजस्विनावधीतमस्तु मा विद्विषावहै. ॐ शान्तिः शान्तिः शान्तिः. जैसा कि मैंने दर्शकों को बताया कि आज योगा टेक्निक्स एंड देयर क्लिनिकल एप्लीकेशंस विषय पर बात करने के लिए हमारे बीच डॉक्टर आशीष फड़के सर मौजूद हैं, जो कि योगा कंसल्टेंट है. आपका पुनः एक बार मैं इस कार्यक्रम में स्वागत करती हूँ सर. आपका बहुत बहुत धन्यवाद. मोरारजी देसाई राष्ट्रीय योग संस्थान के इस कार्यक्रम में आपने आमंत्रण स्वीकार किया और हमारे बीच मौजूद है इस महत्वपूर्ण विषय पर बात करने के लिए. पुनः आपका हार्दिक अभिनंदन तथा स्वागत सर. साथ ही साथ मैं स्वागत करती हूँ हमारे संस्थान के निदेशक महोदय डॉक्टर ईश्वर वी बसवरेड्डी सर का भी, जिनकी अनवरत प्रेरणा आज हम इस वेबिनार की 122वीं कड़ी को पूरा करने जा रहे हैं. आपका भी बहुत बहुत स्वागत सर. ये हमारा सौभाग्य है कि आज आप हमारे बीच मौजूद हैं. बहुत स्वागत सर आपका. जहां तक आज के वक्ता के परिचय का प्रश्न है, तो मैं बताना चाहूंगी कि डॉक्टर आशीष फड़के सर इज डायरेक्टर ऑफ आयुर इंस्टीट्यूट, डॉक्टर आशीष फड़के आयुर्विजन आयुर इंस्टीट्यूट ऑफ आयुर्वेदा एंड पंचकर्म थेरेपी, वाशी, नवी मुंबई, महाराष्ट्र. He is also honorary deputy director, division of endocrine and metabolic disorders, lifestyle modification and yoga module, Kasturba Health Society Medical Research Center, Vileparle, Mumbai. He is working as a guide for students doing their MSc Food Nutrition and Dietetics, Department of Food and Nutrition, SNDT University, Juhu Campus, Mumbai. He has been a visiting faculty of yoga and Ayurveda at various universities and colleges such as SNDT University, Dr. H.S. Gaur Central University, Sagar, Madhya Pradesh, and many more. He has presented number of research papers on Ayurveda, Panchakarma, phototherapy, yoga, and psychotherapy at different national and international conferences in India, Italy, Germany, Netherlands, South Korea, and Nigeria. He has been invited to give lectures, seminars on Ayurveda and Reiki at Italy, Germany, Netherlands, South Korea, and Nigeria, and many other countries. He has more than 30 research papers and articles published to his credit. He has been working as an honorary reviewer for different national and international peer-reviewed journals such as Yog Mimamsa, Journal of International Association of Yoga Therapists, USA, are to name a few. He is a member of various associations and societies such as All India Ayurvedic Congress, National Integrated Medical Association, International Association of Yoga Therapists, Bombay Philosophical Society, are to just name a few. And we are really very, very honored, sir, to have you with us here. आपका पुनः एक बार बहुत बहुत स्वागत करते हुए मैं संस्थान के माननीय निदेशक महोदय से अनुरोध करूंगी कि कृपया 2 शब्द करें. सर.
ओम शांति शांति शांति. आदरणीय डॉक्टर फडके साहब, संस्थान में मेरे सहयोगी डॉक्टर वंदना, इस वेबिनार सीरीज के प्रमुख अंग डॉक्टर नितिन जी, faculty members of the institute, student friends and yoga enthusiasts joining this webinar through various social media platforms of the institute across the globe. My pranams to you all. Hearty welcome to you all for this wonderful evening lecture by Dr. Phadke ji. First of all, it's my privilege to see and listen to Dr. Phadke ji after a long time. And we know each other, and most importantly, being a very renowned expert of Indian system of medicine, Ayurveda, he has also equally taken keen interest in yoga, particularly the clinical research in yoga. Because yoga deals with mind, and where we integrate it very meaningfully, then we give substantial relief to the diseased person or disordered person. I remember Vaidya Kulkarni in 70s or 80s. So he used to talk to me when you ask, Basavaraddi, your yoga posture works. Our pills or these medicines are just feel them that I am taking medicine. That's the way how yoga and Ayurveda. A good expert of yoga cannot ignore the substantial contribution of Ayurveda in yoga treatment to give the maximum relief. At the same time, a good Ayurveda physician or expert may recommend few yogic practices and principles. Our target is to get a relief or give a relief to the patients. So these are the things how I understand. And there are very few people who are flexible in both the systems. We accept the knowledgeable persons. I met Udupaji in the 70s, and R.P. Singh Saab, and Bhagelji, many people, many eminent Ayurveda acharyas. Same thing in Krishna Bhatt and many yoga people. We all know the importance of the system, and we equally respect. So in this aspect, I always have a great regards, Professor Dr. Phadke ji. Is a, I think so already Dr. Vandana has given a detailed introduction. But this is the tag I had in my mind about Dr. Phadke. And the position come and go, but expertise and the system love remains. So that's where we meet. Now coming to the topic, today yogic techniques and their clinical applications. Yoga has several applications. It may be in fitness, wellness, and management of stress, anxiety, or management of many psychosomatic disorders nowadays. So we term them as a non-communicable disorders. Second most important aspect I see that yoga goes with every system of medicine if it is being understood properly. So where the clinical trials, how we can make use of yoga, particularly in Indian system, and I mentioned 3-4 systems. One is Ayurveda and Siddha also, and Indian Prakritik Chikitsa. So there also yoga plays a very important role. But very few clinical trials which are of high standards. Maybe publications are, we have 12,000 publications in peer-reviewed index journals, many of them on meditation. But very good publications on clinical research and impact of yoga on various disease conditions. So it has started way back in 1960s and 70s. In the last one decade, the number of clinical trials has been increased a lot. Many people are taking interest, and thanks to the International Day of Yoga promotion, the Honorable Prime Minister of India, Sri Narendra Modi ji, and that has given it also draw the bright brains towards the systems, eye systems, yoga, Ayurveda, and also when bright brain comes to the systems, and there is always a dialogue, discussion, and that discussions may lead to the quality research. So because research is not a single man entity, it is a group event and needs a lot of consultation, deliberation, discussion, and also discussion. So I'm very happy that today Dr. Phadke will definitely throw on light and applications of yoga techniques. There are several techniques. In nowadays, yoga means only some of the asanas, but we have many techniques. Even common people know only pranayama, breathe, anulom vilom. Only one meditation: sit, close your eyes, and think somewhere. That is meditation. And same thing about only neti kriyas or kapalabhati. But there are many important techniques mentioned in our ancient traditional texts, which are of vital importance in the management of very acute chronic disorders if they are understood properly. So there I mentioned about Professor Bagel, and we discussed about the Nadi and Nadi Shastra, where Ayurveda and Yoga both use it very meaningfully. So where we connect with the prana. So these are all the different aspects. Protocol, we if you take care of such very subtle aspects, which has our own anatomy, sorry, philosophy, anatomy and physiology of yoga and Ayurveda. So we connect with the modern medical science because publications goes, if the modern medical scientists accept this fact and they show interest, then they have to understand our physiology, our anatomy, our concepts, because they are holistic. And many times they don't give immediate relief, but it is substantial relief in the if they are practiced for 7 days, 14 days, 21 days, like that, because they are subtle and it needs some time to adapt. So for even the behavioral change, many people do for 3 days, 4 days. They said that I will bring the change, but as per thing, it needs minimum 12 weeks of regular practice to adopt it as a way of life. So our attitudes will not change in few days or few weeks. There is a substantial changes occurs when they go into the subtle aspect of our personalities. So such needs to be addressed in the years to come. But whatever the existing clinical researches are there and techniques are, I do hope that Dr. Phadke will throw some light on that so that our faculty and students and the yoga enthusiasts joining this webinar through various social media platforms. So definitely it will be a very monumental, very useful for them. So with these few words, I would like to inform to Professor Phadke. Sir, last time, every year, we started on in the pandemic, 2nd October. So it is, we are continuing, and every year we are bringing the abstracts and all these things of this thing. Last year we published, the second year we are coming, and this is the third year. It's going to be one of the important thing. And after the event also, people go to the YouTube. If they don't get the time during this time, they will go and say that much of popular series the institute is bringing. Credit goes to Vandana and all my faculty members. With these few introductory words, I congratulate all my faculty members, and also hearty thanks to you, Professor Phadke, for accepting our humble request and be present. Seeing you, it's a great occasion for me, and thank you very much. with these few introductory remarks, I request Dr. Phadke to deliver his lecture on yogic techniques and their clinical application. Dr. Phadke.
Thank you, sir, very much for a very kind words. And yes, lot of points which you have mentioned, we are on the same wavelength. And I'll be very happy and getting honored to be on this particular platform. So once again, thanks a lot for inviting me and being in front of all of you. And I would be happy to share my views. May I have slides, please? Can I start, sir?
Yes, sir. Yes, sir. Please.
Yeah.
Thank you.
Yeah.
Its platform is yours.
Yeah. So, the topic which we have chosen today is critical study of yoga techniques with special reference to clinical applications. And the moment we read this particular title, then usually people they might get things in mind, like how sir has also mentioned that am I going to speak on clinical trials and the details about clinical trials and what kind of combination of yoga technique utilize in which kind of disease factors, or what kind of biomarkers, or what kind of other techniques. So I'm not actually going to get into those aspects because many people they speak on that. Not that it is not important, but what I want to take your attention to is further specific down the line, very peculiar, very typical aspect about yoga scripts. And if we read script word by word, I repeat, if we understand the yogic scripts word by word, and then we decode the hidden meaning of it, and then if we try to correlate it with that of contemporary yoga research, then I think what I'm supposed to say that will get more specifically emphasize. May I have next slide? May I have next slide, please?
Next slide करो. Slide कौन देख रहा है? अर्जुन. अर्जुन.
Next slide, please.
एक मिनट.
Yeah.
स्लाइड कर लीजिए. आप शेयर कर लिया ना?
I have sent slides to Vandana ma'am because from my end it was not happening.
Maybe some small technical it will be solved. Vandana, are you listening to me?
Yes, sir. Yes, sir.
Just make it free.
Change the slide, ma'am.
Be aware.
Oh, what happened?
No, it will come, sir.
Okay, no issue.
Because maybe some small error.
Okay. So in the meanwhile, I'll speak. So when we actually, as sir also mentioned a few minutes back, that if we go through the research part, whatever has been undertaken in the field of yoga, then we have to go back to one prominent name, and that is Swami Kovalanand, because in 1920 or 25, 26, he has undertaken a lot of research, particularly experimental research, scientific research on various aspects of yoga. And I'm sure most of the students must be aware. If not, then they should visit and read the papers of Swamiji in origin. Okay, so we can get lot of understanding, lot of important studies with pertaining to different kind of yogic procedures. Okay, now coming down to our slides, what kind of yogic techniques we have. So people, as sir also mentioned, people they only speak about asana, pranayam, pratyahar, and so. But I think we should start with yamaniyam, and then pranayam, then pratyahar. And also we start with any yoga session in any school, may it be A school or B school, we start with prayers. So prayers and Omkar chanting, that can also be considered as yoga technique, right? So Omkar chanting, then asana, that is psychophysical portion, and we have got a lot of asanas, meditative asana, then other asanas, so we can divide them. Pranayam, all of us, we are aware what pranayam is, so I need not give the definition part. Pratyahar, bandha, then mudra, then shuddhi kriya or shat kriya, and then finally dhyan or meditation. So these are the areas in which usually we work with. Next, please. Now, when we start doing all this, I particularly feel while learning yoga also, my intention was always to ask question to my faculties then, my masters then, that why do we do that? The moment we do Onkar chanting at the beginning of all yoga sessions throughout the globe, not only in India, not only in Maharashtra or Mumbai, but wherever you go, wherever you do yoga classes or yoga sessions or yoga therapy sessions, everywhere they ask you to do Onkar chanting. There may be some hindrances, maybe some inhibitions while chanting Om if you are not of particular religion. So I have, when I was doing my PhD in yogic subject, and then I had a group of students, those were Christians and Muslims and other religion, and they said, sir, is it necessary to do Onkar? I said, okay, if you're not comfortable, then you can do humming. But you understand why we do Om or why we do humming. And do you know the exact reason why we are supposed to do, or what is the relevance of doing that? Keeping all scriptural and religious part apart, you will be very happy to know that when we chant Om several times in a repetitive way, in a specific way, how to chant Om in itself is a separate technique. Whether O and M has to be half half, or O one third and Makar has to be elongated two third, or O two third and Makar has to be one third. So there are various ways to do even Omkar, but by doing Omkar, what happens is there is a release of a particular hormone inside your brain, and that is known as beta endorphin. So that beta endorphin is a hormone which will keep you calm, composed, quiet, and which will make you feel happy. So feel happy hormone. So that is one of the reason why we do Om. And if we teach our students that, look, we are supposed to do Omkar thrice in the beginning and at the end, it will be useful for you, not only for your spiritual upliftment, but for your physical thing level as well. Then when we speak about yoga, is it directly connected with therapy as a therapeutic yoga, or is there any direct reference of yoga therapy in any classical yoga text, particularly that of Patanjali? And is it justifiable, or are we going to discuss or supposed to discuss yoga with disease centric approach, or are we supposed to discuss yoga with patient centric approach? Then are there anything pertaining to yoga as a disease, uh, you know physical diseases or psychological or mental disorders? So many questions can appear next to our mind the moment we say we are thinking of yoga technique vis-a-vis to clinical application. So yes, we are going to see some of the things in today's presentation because the time is very short, but then we will try to give justice to it by touching upon two or three aspects. Now, therapeutic yoga has evolved much later. Actually, yoga was never been mentioned for therapy, for curing diseases per se. Okay, but in Patanjali, or in particularly in Patanjali, you will see that later. There is no direct reference that it will really cure yoga, but uh, you see the reference of disease, or to which we call in Sanskrit vyadhi, as a one of the component in antaraya, right? But whereas if you go to the various texts of hatha yoga, which is much later in a historical line, so you see whether it is Shiva Samhita or Geranda Samhita or your Hatha Pradipika mainly. So you see in the discussion of various asana or pranayam or bandha or mudra, you see invariably the language of Ayurveda. And sir just now said that Ayurveda and yoga, they go hand in hand. And I'm very happy to mention over here that, okay, Whether we do research in yoga with reference to modern medicine, fine, that is required for today's era. But to understand the script properly and to understand the meaning of what they have tried to mention in the shlok, we must know some of the basics of Ayurvedic concepts. And if we understand that, then we can understand, decode the meaning of those particular verses more properly. Then disease centric approach means what? So in Hatha Pradipika, you will see a lot of discussion about diseases like Shwasa, Kasa, then Agni Mandya, then Grahani. So many disease names are coming which are immediately taken, directly taken from Ayurvedic literature. Okay. Then what is disease centric approach, which many people they had even now, in the last few decades, it was more specific, like yoga for hypertension, yoga for asthma, yoga for mental disorder, yoga for GI tract disorder. So this is disease centric. But over a period of time, people they have realized that we are not supposed to give equations. Oh, for this particular disease, ABC asana practice, ABC pranayam is kind of prescription. So no, it's not. So it has to be tailor made with reference to particular patient. And so this has actually slowly diverted towards patient centric approach. Okay, I'm not getting into details of those because that itself will cover around 1 to 1.5 hours. So there is a concept of salutogenesis, there is a concept of your eudaimonia, and how yogic approach is going hand in hand with these two approaches, and not as the approach of modern medicine, but which is nothing but pathogenesis. Okay, so here it is towards wellness. Sir said yoga can also be understood for wellness. So that is with patient centric approach. Vyakti, paroksha, we can have tailor made treatment for those particular individuals having their needs. Then physical diseases and psychological or mental disorders, again same thing, I have already mentioned a little bit earlier. Next slide please. Yeah, now this is what is Antaraya. I don't waste time in reading out all the names. We all are aware what Antaraya are. And the very first is Vyadhi. And they are mentioning that why Vyadhi has to be first, because if you are diseased, then naturally you will not be able to practice yoga the way you should be. Now just see the fun. Even now, whether you take admission for diploma in yoga, whether you take admission for TTC yoga, whether you go for MA level or PhD, particularly MA up till MA, you require to get a certificate, fitness certificate, physical fitness certificate from your doctor that you are not suffering from any diseases. Because if you are suffering from diseases, then you may not be able to practice some of the practices, yogic practices. So there, Patanjali Muni has mentioned about Vyadhi. Okay, next please. Next slide please. Please be quick, otherwise we will be losing time on that. Yeah. Now, if we see this particular shlok, which is there in Hatha Pradipika, in first chapter, 18th number shlok, that shloka's Falashruti means what that particular practices gives benefit. So that says, Dandadvayam Kapale Dve Adau Pitha Chatushtayam Vaishamyam Saptadatunam Nashayanti Murtata. So here they are trying to say that there are specific practices that they have mentioned earlier. If you do those practices, then it will help you to remove Vaishamyam Saptadatunam. Now, what is Saptadhatu? Saptadhatu, according to Ayurveda, it is Rasa, Rakta, Mausa, Meda, Asti, Majja, Shukra. So these are 7 kinds of vital tissues, right? So lymph, then blood, then muscles, then bone, likewise bone marrow, and your reproductive tissue. It's not, Shukra means not just sperm, because in female you have got ovum, so it is reproductive tissue. And of all those 7 vital tissue, collectively there is a elixir which is known as ojas or oja. So even that, and more than that, the Tika says, Josna Tika of Brahmananda Swamiji, he has mentioned that when we say Dhatunam, it doesn't only restrict to only Saptadhatu. It also speaks about dosha, that is Vata, Pitta, Kapha, and Trimala. Okay, Mala, then Mutra, and Sweda. So it will, remove the Vaishamyam. It will remove the disharmony in dosha, dhatu, mala, and also Agni and Murtata. The moment you practice this carefully, you will get this particular benefit. Next, please. Now, what are those four practices? So, swastikam, gomukam, viram, chittam, chanchalya nashakam, nivruttaye sarvaroganam, lagu kurmam cha kukkutam. So, in this swastikasan, we do in most of our practices, we teach our students, right? We ask our patients to do. We also know about what is Gomukhasan is, but hardly we pay attention to this particular line. And it says that it is very useful in Chitta Chanchalya Nashakam. So, what is Chitta Chanchalya Nashakam? It is nothing but your stress and anxiety. So, when we are making protocols to give to the patients, those who are suffering from anxiety or stress condition, we must include Swastikasan and Gomukhasan. Okay, then Nivrutte Sarva Roganam Lagu Kurmam cha Kukkutam. So, Kurmasan, Lagu Kurmasan and Kukkutasan, they are helping to get rid of all disease. That is what Tika says. Josna Tika has explained about it. Next, please. Now, who should practice yoga? In that, again, in Hatha Pradipika only, you see Yuva Vruddhoti Vruddhoa, that shlok, everybody, by heart, rectify that and put down in answer sheet and get good marks. But beyond that, if we start practicing yoga therapy, or if we start practicing yoga for ourselves, or we teach to our students, then we should understand that it can be given to Vruddha and Ati Vruddhova. So we can't say no for teaching yoga to even geriatric population and also to disease population. I know that yoga can be of great help to bedridden cases also, but we need to know what kind of yoga has to be given to whom. Okay. Then Durbalo Piva, for example, sir was speaking about COVID-19, and we are all aware that how yoga has done wonderful work in this particular pandemic. Okay, so even in convalescence period, when the person is not able to move his limb and all, that time also we can ask certain specific techniques to do with, and then we can bring about betterment in his physical as well as mental aspect. So naveshadharane siddhe karanam cha nacha tatkatha kriya iva karanam siddhe satyam etatra samshaya. So just by putting t-shirts or garbs which are depicting that you are from yoga school or some institute should not make enough. Earlier days, people used to explain this particular shloka that you should not have that saffron robe. Nowadays, people, they don't wear saffron robe. They use jerseys or they use t-shirts. But more than that, more than just mentioning that okay, I am going to school or I am going to institute, we should do kriya, we should do practices and on a regular basis. As sir mentioned, sometimes on a not just few weeks or not just few months, but for a long term, satatam abhyasam, in that way. Next, please. So coming down to, after having this kind of discussion, we will now take few examples. For example, I am giving example of Padmasan. Now see, Padmasan is well known for everyone, and Padmasan, you may say what he is going to speak and why he is wasting time, and what is the correlation of Padmasan with that of your clinical application. So I don't read the method of doing it, Vama Upari Dakshinam cha, that everyone is aware and able to do also. But what is that most important I felt, that Etat Vyadhi Vinashakari Yaminam Padmasanam Prochate. That line is very interesting. And after describing how it has to be performed, then Swamiji Swatmaram ji says that it destroys all kind of diseases. Now, forget Atishayokti, but definitely it is useful. And it is one of the very important meditative posture and the base for getting into other asana practices, right? So there was question in my mind when I was learning. By the way, I'm a student of late Yogacharya Nimbalkar sir, who is no more unfortunately, but I had opportunity to get trained under him. I also had training at Kaviladam earlier. So I always used to ask my yoga faculty teachers that why we should have these meditative postures, and why particularly Padmasana is been so upheld. So there was one study by Pratap V, and who actually studied this particular posture in a specific way. He asked 12 yoga abhyasi or yoga sadhaka to sit in this particular yogic posture of that of Padmasana, and he compared it with other 12 people in a non-yogic posture. Okay, and then he came to know, he did certain techniques by virtue of which he came to know that those who sat in Padmasana, there is a significant reduction in their respiratory rate, and apart from the increase in their stability. So now you will understand how Padmasana is so important for doing meditation. And there is a paper, when we say that we give kind of referencing, then there is a paper which you can look back in Yoga Mimamsa way back in 1969. So we can now, this is a pilot study, this is not a good number to make with, but at least this gives you idea, this gives us a base that why particularly Padmasana is to be followed. Next please. Now swastikasana. Next is swastikasana, which is comparatively easier posture. Now again, everyone knows how to do swastikasana and how it is to be done. So what is the important part of this? So swastikasana, the muscles of both lower extremities, the flexors are greatly contracted and pressed. So when I have got this hand, so these muscles are flexor and these muscles are extensors. So likewise in leg also, the inner part of thighs and inner part of your calf muscle, gastrocnemius and all, they are flexors. So flexors are greatly contracted and pressed when you have swastikasana. This circumstance, coupled with the passive control of all muscle of the lower extremity for a considerably long time, interferes with the free current of blood circulation. So when you sit in this particular way, there is a circulation of blood and there is a free current. Okay, and it interferes with the free current. So it is restrictive but not completely stopped. That being the case, the pelvic region gets a larger blood supply from the abdominal aorta. So abdominal aorta comes, this thigh goes down, and there is a abdominal aorta which goes down and then gets bifurcated. So that from there the supply to that of pelvic floor gets enhanced, and that facilitates the toning of the coccygeal and sacral nerves. So the nerves which are there in that particular zone gets benefited. Now see, usually when we learn swastikasana, we only learn the technique, right? At the most we learn what are the benefits to the extent in कौन से रोग में ये काम आता है, कैसे नहीं करना चाहिए, कैसे करना है, that's all fine. बट अगर हम ये पढ़ते समय अगर हमने जो एनाटॉमी फिजियोलॉजी सीखा है उसमें थोड़ा डिटेल में जाते हुए उसका अगर अध्ययन किया और उसको जोड़ने की कोशिश की, तो आप समझ सकते हो कि how it will enhance, empower our understanding while doing this particular yogic practices. Next, please. Yeah. So swastikasana pose is the easiest amongst all the three poses of meditative poses, particularly Padmasana, then your Siddhasana and Swastikasana. So ये तीनों में Swastikasana comparatively easy है. Okay. The adductor, the important part is because the feet cross one another in the middle of the body and end up in the natural and stable position planted against the opposite thigh. So पाँव की जो तलु है ये थाइस के अंदर ही रेस्ट होते एक दूसरे के संलग्न में, तो इसलिए ये स्टेबल पोजीशन है और वहां तकलीफ नहीं होती है आमतौर पे. एज अगेंस्ट इफ यू सी द लोटस पोज, द पद्मासन पोज, अगर आप पद्मासन में स्टार्टिंग में बैठते हो, हाँ आपको अगर बहुत लंबी प्रैक्टिस है पद्मासन में बैठने की तो आगे जाते हुए आपको तकलीफ नहीं होती है, मगर जो बंदा शुरुआत में कर रहा है पद्मासन की प्रैक्टिस तो कुछ समय के बाद बोलेगा सर मुझे अभी बहुत दर्द हो रहा है, क्या मैं आसन से बाहर आ जाऊं, because he or she gets pain at the level of ankle joint, right? In your Siddhasana, it is again very different pose whereby you put एक एड़ी दूसरी एड़ी के ऊपर रखते हुए then you press it close to symphysis pubis. So that is again a difficult pose because it gives exertion onto your knees and the inner thighs. Okay, so here the adductors and pubofemoral ligaments are not stretched excessively, and the knees and hip joints are not placed under intense torque. तो आदमी इस पर्टिकुलर साधक इस पोज में काफी लंबे समय तक बैठ सकता है, एंड पर्टिकुलरली दोज हु आर यू नो शुरुआत में जिनकी शुरुआत हुई है योगाभ्यास में, उनके लिए ये पोज कई बार बताया जाता है कि आप ये पोज में अभ्यास करें आपका. नेक्स्ट प्लीज. So as already I have mentioned that there are 3 different meditative poses, and the goal of these seated poses, that is Sukhasan, Swastikasan, Ardha Padmasan, Padmasan and Siddhasan, is steady, most steady, and it gives steadiness and ease. So स्थिरम सुखम वाली जो स्थिति हमें आसन से मिलनी चाहिए वो हमें ये पोज से मिलती है. वज्रासन इज वन मोर, बट ये मैंने जो ब्रॉड बेस ट्रायंगल शेप जिसमें मेंटेन हो जाता है बॉडी का, उनका खाली मैंने यहाँ जिक्र किया है. Pelvis and legs are arranged in a way that it clearly supports the spine, and spine can then be supported for skull, and the spine and skull can together protect the brain and spinal cord. तो आप देखिए अगर पेल्विस और लेग इस प्रकार से अरेंज है कि जिसमें स्पाइन सीधा खड़ा अपने आप हो सकता है. आप अगर मैं जैसे अभी कुर्सी में बैठा हूं तो आई हैव टू मेक effort to keep my spine straight, otherwise I am going to get sagged down, right? तो यहाँ वो sagging down नहीं होता है, तो spine straight हो जाता है. spine straight होने के बाद में उसको उसकी हेल्प स्कल को सीधा रखने में, और स्कल सीधी होने के बाद ब्रेन जो अंदर है हमारा उसको और स्पाइन को प्रोटेक्टिव कंडीशन में रहने के लिए क्या कहूँ मैं, इट विल बी हेल्पफुल. तो ये स्थिति प्राप्त होने के बाद में what happens is the nervous system can register that this sense of support and ease and turns its attention to practices such as प्राणायाम और ध्यान. तो जब बॉडी रजिस्टर कि भाई अभी मेरा ब्रेन और नर्वस सिस्टम स्पाइनल कॉर्ड दे आर इन अ बेटर पोजीशन, दे आर इन अ प्रोटेक्टिव पोजीशन, तो उनका जो अपना अटेंशन है इनको स्थिर और इनको प्रोटेक्ट करते रहने के लिए वो हट जाता है, एंड बाद में वो अटेंशन वी कैन यूटिलाइज फॉर द प्रैक्टिस ऑफ प्राणायाम और मेडिटेटिव प्रोसेसेस और ध्यान. When the spine is supported effectively by pelvis and legs, the ribs are free to move with the breath. Okay, and rather than becoming a part of support system of the sitting. Usually when we sit and otherwise, then this rib cage is also important to keep the spine in a position, right? But when we sit in this meditative pose, then the spine is erect and the skull is also hold straight. So these ribs get chance to float freely, and that free floating of these ribs or moving of these ribs with the help of intercostal muscles you all are aware of, so I'm not getting into it. It will help us to do practices like pranayam in a appropriate way. In this posture, the position of cross leg that allows the weight of that should fall most clearly from the spine through the pelvis into the sits bone, that is symphysis pubis. जो अपना क्या कहूँ पेल्विस गर्डल है, वो पेल्विस गर्डल में नीचे एक हड्डी होती है उसका नाम है सिम्फिसिस प्यूबिस और सिट्स बोन, जिसके ऊपर हम बैठे हैं. जब भी कभी हम बैठते हैं नीचे ग्राउंड पे तो वी आर रेस्टिंग ऑन दैट सिम्फिसिस प्यूबिस. तो वहां से वो सेंटर ऑफ ग्रेविटी गेट्स डाउन and it goes to get the support of floor. In this way, the minimum amount of muscular effort is needed to align the bone for the support. So that's how indirectly, unconsciously, your body understands that, okay, now you are in a most balanced and most supported and most direct way. So let us do the best, let us give the best in the process of your pranayam or dhyan. In a well-supported seated asana, the intrinsic equilibrium of pelvis, spine, and breathing mechanisms support the body and energy that has been liberated from postural efforts that can be focused on a deeper approaches such as pranayama and meditation. Same thing I explained earlier. So why we should pay attention towards the deeper part of anatomy and physiology with modern side, and sometime later I'll also speak towards Ayurvedic aspect and yogic aspect of anatomy and physiology also. So that this is one of the best example. Next, please. Now coming down to next practice, that is Paschim Tanasana. Again, mostly widely practiced in most of the courses, irrespective of whether it is A institute or B institute. And then it has been said that this is going to be really very, very good exercise, very, very good, no, practice. So, iti Paschimottanam asanam agryam pavanam paschimavahinam karoti. Now, what does it do? So, it has been mentioned in the first line that it helps to move pavana, that is vayu, paschimavahinam karoti. It helps to move vayu in a posterior zone. Posterior means this is anterior. Okay, I'll start video. One second. So anterior means आगे का हिस्सा and posterior means पृष्ठभाग पीछे का हिस्सा. So it helps to when you go down and try to take your head low position and try to catch hold of big toes with your thumb. So it helps that pavana, that is vayu, which is there inside your body, paschima vahinam karo, to go it backwards. Okay, and what does it help? So it helps in udayam jataranalasya kuryat, udare karsham arogatam cha pusna. So it helps while discussing while doing this. What does it do? It udayam means increasing. It dawns. It dawns what? Appetite. It dawns the digestive fire. It dawns the metabolic capacity of your body by doing this particular asana. Okay, kuryat udare karsham. So udara karsham, most of the time you see people, they have got truncal obesity, पेट तंदुल बाहर आया है. So वो भी कम करने के लिए भी ये आसन का प्रयोग आप कर सकते हो या उसमें उसकी सहायता होती है. And not just that, but because you are doing जठरानल का प्रदीप्त होने के कारण, अग्नि को बढ़ाने के कारण आपके सभी रोगों का नाश होता है. अरोगता च पुंसान. It will just remove all kind of diseases in a human being. That is what it has been mentioned. Now, Vayum Paschima Margena Tasya Charitam Nishchitam Etad Abhyasakanam Sarvasiddhim Che Jayate. That is what has been mentioned by Giranda Samhita. And while discussing Paschimottanasana by him, there is a reference in the Tika, and that it is also termed as Ugrasana, because the nature of that asana is Ugra, and it is not that easy. But those who are supple, having supple body, and they are lean and thin and not rigid, they can do this asana easily. But those who are grown up and started yogic practice much later, okay, or those who have got arthritic tendency or sero positive arthritis, or HLA-B 27 spondylosis, ankylosing spondylosis kind of stuff, they will feel much difficult. So okay, according to their capacity, we can ask them to practice this particular asana. Now after knowing this, it will be even interesting to see, next slide please, that how this particular asana was studied in great depth. Next slide please. Next slide please. Yeah. So Swami Kolanand has recorded and followed, actually did certain observations on this particular asana way back in 1926. He mentioned that with this posture, nearly all posterior muscles of the body, and particularly the hamstrings, that is your calf muscles, are getting fully stretched and also relaxed. The front of abdominal muscle, especially the two recti, the two rectus muscle, which are just next to your umbilicus on either side of your abdomen. So where the thigh is, on the other side, the either side of the thigh, there are two recti muscle. and those are termed as rectus, abdominal rectus. So these two recti muscle, rectus abdominis, are vigorously contracted, and which ensures better health and functioning for them. But a yogi culture is the person who is into yoga for long time, to him, Swamiji is referring as a yogi culturist, can by practice relax them completely and may take them up in the process with that of Uddiyan. Now, I'm not supposed to explain what Uddiyan is because you all are learned people in yoga. So when you do this particular asana in a bowing down and reaching out to your big toes without having flexion, without having bent at your knee joint, and when you stretch out your this particular posterior muscles and all, same time when the recti are contracted, but with the specific technique, you can have Uddiyan and they will be taken care of during this pose. The side muscles like psoas major, psoas minor, and iliacus, they are also very vigorously contracted and stand in the same condition throughout the posture. So that is what he has mentioned and seen and mentioned and written in his paper. All these contracted muscles strongly compress in the abdominal viscera. Compress what it compresses? It compresses the abdominal viscera, that is different organs in the abdominal cavity. In this posture, the lumbosacral vertebrae are posteriorly stretched. So lumbosacral vertebrae are those who are in the lumbar region and last 5 vertebrae basically. Okay. Nerves supplying the pelvic organs and arising from lumbosacral region are toned up because of this lumbosacral part of the spine and consequent richer blood supply brought to that particular part. You can logically understand when you are pushing like this, so the blood will gush down and that will have richer blood supply to that particular zone. So this is what we can understand the benefit which can be achieved by doing proper Paschim Tanasana. Next, please. Next slide. Next slide, please. Yeah. So this is the pose which everybody is aware of what Paschim Tanasana is. Okay. Sorry. One sec. Go one slide earlier, please. Sorry, I made mistake. Yeah. So there is another paper, very interesting observation by Emil Garote, who was the contemporary researcher along with Swami Kolanandaji in Kaivaladham those days in late 20s. So he has found that there is he studied the intragastric pressure which is developed in the 4 variations of this Paschim Tanasana, such as Paschim Tanasana, the one which is done in sitting, which we just now saw the figure. Then Ardha Paschim Tanasana, like in Mahamudra, Janu Shirasana, and then you go down and you hold that. So Mahamudra. In Shaita Paschim Tanasana, that you lie down on your back and take legs up and take them behind. Okay. Then and Uttana Paschim Tanasana, that is something like your Hastapadasana. Okay. So in these particular poses, the rise in intragastric pressure was minimum, that is 3 to 3.5 millimeter of mercury in Ardha Paschim Tanasana, that is in Mahamudra position, and also in Shaita Paschima Tanasana, that is in lying down position. And it was maximum seen, that is 5 mm of Hg in Uttana Paschim Tanasana. That is the one subject who is doing in a standing pose. Okay. In one subject during 8 observations. So he tried a particular group of subjects and made them do this particular asana, and with the pressure investigations, they came with this kind of readings. Now, pneumographic recording and blood pressure did not show much change in this particular case. This indicated that these variations of Paschim Tanasana did not differ significantly from each other. So if somebody is not able to do Paschim Tanasana in particular pose, you can still ask that particular person to get the benefit of Paschim Tanasana in some other optional poses. That is the inference which we can infer by looking and reading and understanding these kind of research papers which has been done way back in 1920s and 26. So that is what I wanted to. Oh, this is sorry, this is not 1926. Sorry, this is 1982 paper. So comparatively much later, but still for us it is much earlier. 80s means still it is earlier, and this is what we can learn from what our stalwarts have already done. Next slide, please. Yeah. So in this, we can see that this is the pose. This is the right way to going ahead with. One important point I need to emphasize over here, that while getting into pose and coming out of pose, particularly getting into pose, we should do some institutional practices. I always suggest my patients, or I always suggest my students to do rowing practices. You just ask them to do rowing, and after rowing for around 10 to 20 rounds, or even more than that, and more rigorously, and then ask them to approach the big toe, and they themselves will be very happy to see, oh sir, now we can catch hold our big toe, because the mobility increases in such conditions. But then there were studies by Gore GM, Dr. Gore sir, and Dr. Bole, both were doctors, and they have studied that what are the changes with the cardiovascular health with reference to this particular practice. So they have observed that heart rate increased by 32% when Paschimottanasana was practiced with an isometric base. Okay, whereas it is increased by 13% when it is repeated 4 times with an isotonic base, and only by 6% when it was performed in a relaxed manner as a posture for 1 minute each. So that's how, while explaining our patients, while explaining our students, when we say that while doing practice, any yoga practice, we should follow concept of relaxation, and that relaxation has to be learned carefully and to be taught carefully to them. Only that part of body part which are getting into active way, only that will get little contracted, but the rest all part of the body should be relaxed. So our sir Nimbalkar sir always used to say sajaga shitilata, sajaga shitilata. He used to use that term for that. Conscious differential relaxation. He usually use that particular term in his books. So when you do this particular way, then the heart rate which is increased is only 6%. So still fine. But if it is done in a isometric way, then it is maximum. Isotonic way, it is maximum. Like no, isometric it is 32 and isotonic is 13. So still much higher than that of 6% of relaxed way. So this part we have to understand. Next, please. Now the natural question would be what you are speaking about. We are aware, but we are not very sure. So what isotonic and isometric is this? So when you have same tension, hold with, but the changing length, and in the figure you can see you have got same tension, the weight is same, but then the length becomes different because of the contraction and relaxation of the muscle. That is isotonic. And isometric, the length, metra means measurement, so iso means same, so same measure, but the tension will differ. Okay, so in contraction and relaxation, the tension will get changed and the measure will remain same. So having utilized with this particular technique, which is again a little different way, and one need to learn it through proper experts, but this is what is all about, isometric and isotonic. Now coming next, ma'am, let me know how much time do I have? Hello? Okay. Now let us go with the next common asana practice, that is Bhujangasana. And Bhujangasana, if you see the Falashruti, that is the benefits of Bhujangasana as mentioned by Geranda Samhitakar, it has been mentioned that Deha Agni Vardate Nityam Sarva Roga Vinashanam. Dehagni Vardate Nityam Sarva Roga Vinashanam. Jagarti Bhujagi Devi Bhujangasana Sadhana. So it helps to increase your digestive fire, and it is quite natural because you have pressure on your navius, and this is the area where your saman vayu, according to Ayurveda. I am not getting into yoga discussion and description of pancha vayu. If we go with the discussion of vayu, and that is samana vayu and samana pitta, then it is at this zone, the zone of navius, and there you are having slight compression, slight pressure, and having this particular posture, it increases agni vardhan, that is jatra agni vardhan, and because jatra agni vardhan is there, sarva rogam vinashanam, so that part has been taken care of. Now here I deliberately showed both the postures. The classical one is the one with first photograph where that lady is practicing. And we, while teaching at our Yoga Vidyaniketan, at other institutes, we say that when you lift your hand, then you should not fall down. And that is the right way of getting into that particular technique of Bhujangasana. But at some other places, they also have institutional variation whereby you're supposed to raise completely and make no angle at your elbow and stretch it completely. Both are good, but we need to know. Next slide, please. These particular technique are usually been recommended for practice of those who are suffering from chronic low back pain. Okay, and due to different origins, due to different causes, and something like lumbar spondylosis, which is supposed to be one of the major cause for orthopedic OPDs nowadays, right? Or lumbar spondylolisthesis. Now, what is spondylolisthesis? You have got spondyles, that is vertebrae, and you have got a disc, intervertebral disc, and that disc is slightly subluxated, slightly come out. So that part is termed as lumbar spondylolisthesis, or complete subluxation, that is slip disc, that is PID, prolapse intervertebral disc. So in either or, we suggest to do Bhujangasana in a chronic phase. If a person is suffering from acute phase, he or she will not be able to even get up, and he is not supposed to get up. He has to lie down, and at the most we can suggest them to do only yastikasana or just bed rest, nothing more than that, because nature works at that particular moment. And then if even worse, if there is a radiculopathy and there is no power in the limb, one cannot able to lift leg or move leg, in that case we have to refer them to spinal surgeon or orthopedic surgeon for surgical intervention if it is required, or for the intervention of traction for that sake. But in a chronic phase, if a person is suffering from low back pain for a long time, then we can suggest them to go for Bhujangasana. But when you give the first variant where you can lift hand and you can be there, it is still much safer. But when you do the outstretched hand, then it gives a pinpoint pressure onto the lower back slightly above, and if it is harming to that particular patient, then we need to be very careful looking at the plates of CT scan or looking at the plate of your MRI or even X-ray. You can then choose between the two and suggest what is to be done. Okay, it gives a gentle pressure in the lumbar region when gets into the final pose. There are few institutional variations performing Bhujangasana, already I have mentioned, and they have got their own pros and cons. Okay, now Bhujangasana mentioned in the relaxed manner after deep inspiration. Now this is very important. Please have attention. If you do Bhujangasana maintained in a relaxed manner after deep inspiration, revealed increase in stomach pressure by 12 mm of Hg. Now, if you inhale and hold it and then do, then it will increase 12 mm of Hg. But if you have this particular procedure and hold it after deep expiration or deep exhalation, then it will create negative pressure of that of tune of -2 mm of Hg. Whereas normal inspiration and expiration revealed pressure in between these values. And therefore, many times, most of the institutions, yogic schools, we suggest that you do in a normal, you can have normal way, not to hold it too much, not to exhale too much, but have moderate way. Okay, and that will not harm you. Next, please. In Bhujangasana, there are other studies by Bhole and group. from Kaivaladam only, who conducted this study, recommended patients having high blood pressure would be advised to do Bhujangasana under exhalation or after exhalation. So if a person is having BP, high BP particularly, then it is to be undertaken with exhalation, under exhalation, or after exhalation, so that it will not tend to increase BP and will not exert strain on the heart. So very, very important tips we need to remember. Otherwise, what happen? We just give tick, 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 for emphysema, these asanas, for BP, that asana. No, it needs to be very patient specific. That's why in the beginning I mentioned that earlier it was to be disease centric, but now it has to be patient centric. Now, patient with respiratory problem like emphysema, where you have all accumulation of cough within your lungs, okay, sometimes even pus as well. So it is advisable not to do this practice after deep inhalation, because that it has to be rather done. It should be done after exhalation. So very important. Practice with problem of packets of alveolar collapse. Now, what is alveolar collapse? You have got this, grapes जैसे द्राक्ष जिसको हम कहते हैं, उसके जैसे जो स्ट्रक्चर्स है लंग्स में, which are the having basic unit of your respiration. So alveoli is the basic unit of respiration. So when they are not functioning, they are losing their elasticity, and when they have contraction and relaxation, they inhale oxygen in and exhale CO2, right? So that exhale CO2 means not actually exhaling through here, but then there is a transfer of oxygen and CO2 through the blood vessels around them. Okay, and that CO2 through blood will get in, and that alveoli will then ultimately throw it through your nasal passage, naso bronchial tree. So in that particular condition, or if a person is having poor ventilation, should do this practice with deep inhalation with continuation of deep breathing in asana. If you don't do that, then it will get even worsen. So same respiratory tract disorder is there. Emphysema is one thing, alveolar collapse is other thing. In one, it has to be done after exhalation, whereas in other, it is to be done with deep breathing or deep inhalation. Okay. Then in irritable bowel syndrome, which is again a very common in metro cities like Mumbai, Delhi, Calcutta, and most of the cities. So in those cases where the anxiety, where there is a psychosomatic aspect, a person has to do this particular Bhujangasana technique with deep inhalation. Okay. Bhujangasana should not be carried out if it is contraindicated after deep inhalation if the case is having known problem of hernia. If a person has got hernia, then he should not do deep inhalation, because if you do deep inhalation and then do Bhujangasana, then you are exerting pressure, and then it will create problem to the herniated level. Okay, so that is to be kept in mind. And the last but not least, in psychiatric cases, this asana can be performed after deep inhalation in cases of depression. So if a case is of depression, you know the basic difference of depression and anxiety, I am sure, right? So if a person is suffering from depression, then we must ask that person to inhale, hold it, and do Bhujangasana. Whereas if the person is having anxiety, more of anxiety disorders, then that person has to do this asana and maintain under deep exhalation, or otherwise not necessarily in exhalation also. He can maintain it in a normal breathing or normal respiration. So these are the variations of Bhujangasana practices uh, in various disorders, in various disease conditions. And usually our attention only limits us to only remembering, oh, BP, this asana, asthma, that asana. So no, a same asana can be also given to different conditions, even considering modern medical terminology or Ayurvedic terminology in a specific way. Next, please. Now, Bhadrasanam bhavet etat sarvavyadi vinashanam. So you try to look at the Falashruti, at the shlok, it's in blue, I mentioned. So it is mention in Jyotsnatika that it is Sarva Roga Vinashini. And then if you go through the other aspect of anatomy and physiology and biomechanics of yoga, then you will see that Bhadrasana is known to improve the pelvic floor muscle. The asana brings about remarkable flexibility of the hip, knee, and ankle joints. While examined under X-ray, it has been observed that there is a great improvement in a range of mobility of hip joint as well as knee joint and ankle joint after continuous careful practice of Bhadrasana. Now, this last line is very, very careful. If you don't do carefully, it can harm, right? But if you do carefully, it will not harm, and it is one of the wonderful asana. And we know most of the gynec problems, we suggest this particular asana, particularly before delivery and all, or PCOD and all kind of cases. We suggest this. Next, please. Now, Shavasana, which is one of the very well-known asana, everybody is known about it. Everybody thinks that this is the most simpler asana, but I suppose this is one of the most difficult to perform with if it is to be done correct way, right? So, Shavasanam is Uttanam Shavat Bhumo Shayanam Tat Shavasanam. Shavasanam Shrantiharam Chitta Vishranti Karakam. That is very particular, very typical, very uh, carefully chosen Falashruti by even Hatha Pradipika as well as Garanda Samhita. So, Shranti Haram, Shranti means you, by giving this particular asana, you make that subject, you make that patient feel relaxed, okay, and not relax mentally, but even physically. So, either way. And Chitta Vishranti Karakam, it will help you to get distress also. Okay. So there are number of research studies undertaken on Shavasana and its relaxation response. It is found out to be useful even in essential hypertension. Now, what is essential hypertension? There are types of hypertension. I'm sure your professors must have taught most of the students. I'm referring to students. Please don't take advice. I know there are many students, those who are attending this particular webinar. So I'm referring to them. So hypertension, and hypertension can occur due to several causes. And if it is due to certain specific cause, for example, you have got kidney stone and if it is impinging in the kidney, urinary tract system, then there is a renovascular hypertension. It is because of the blockage and the obstruction in the renal level. So there are certain things like, because of certain cause, if BP is there, then it is secondary hypertension. But in certain patients, you see hypertension is there for no reason, and the BP, if you listen to the values like 210 by 130, 140, and in spite of giving all kind of treatments, modern medical treatment, they are not responding to it, and that's the big question mark in front of medical fraternity. How to resolve, how to help these kind of patients? And way back in 1969 at KEM hospital, Dr. Date and his colleagues, his group, they have thought of, Dr. Date sir has been in touch with Swami Kulanandaji, and even my Guruji, Nimbalkar sir, was his disciple that time, and he was telling me, he has said couple of times to all of us in the our institute, that Dr. Date has learned, when he learned this particular asana, and when Swamiji mentioned about this, that this is what is the falashruti of this asana, then he devised this asana in a specific way. See, when you want to do clinical trial, just now Dr. Basavaraddi sir has mentioning that clinical trial needs to be done methodically and very carefully, right? So those time he has standardized this shavasana, how one can lie down, how should be the position of palm facing sky, and we all know that, but he made a protocol of how to go in and how to come out. And after making their patients of essential hypertension and the controls, those who are normal person, and when he studied, and it found out to be very, very useful, and that paper was then presented and also got published in one of the very prestigious journal in angiology, right? Or even Journal of Heart, the name of the journal is Heart, or Hypertension. So in 2-3 journals he has published. This is a reference from angiology, and this is what people are still using. our Guruji, Nimbalkar Guruji, has renamed this asana, and he said Shavasana looks little odd, Shava. So let us call it as Chaitanyasana, because after doing this particular asana, you feel energized. So he renamed it as Chaitanyasana. There is another form which has come in this modification of this very same Shavasana, and I'm sure all of you must have recognized by now, and that is what is Yoga Nidra. And Swami Satyananda ji has coined that particular term Yoga Nidra, and developed that particular method. And all of us, we are using that Yoga Nidra in many ways. In Yoga Nidra, apart from this particular method, there is a also role of sankalpa. So I'm not getting into that, but even Yoga Nidra has got a lot of correlation with clinical applications. That's what I wanted to say. Sir, I would like to know how much time do I have? I can continue till
Sir, actually, the time was till
5.
6. 6.
6, na? Okay.
Yes.
I thought time is still 5, so I was wondering whether. Sorry, 6. Okay. So now it is 6:15. So shall we stop here, or shall we continue?
Sir, but we can conclude in 5 to 10 minutes.
Okay.
Okay.
So go next. We'll not go with all
Okay,
the
sir.
details.
Okay.
Go next slide, please. Next slide, please. Yeah. Now, pranayam is another very important technique, but without particular measures, adau sthanam tatagalam vitaram tataparam nadi shuddhi tata paschat pranayam cha sadhet. If you don't follow these particular, uh, prerequisites, then it will create problem. And vitaram vinayastu yogaramam samacharet nana rogo bhavetasya kinchit yogana siddhyati. That is what has been mentioned by Sutrakar. And next, please. And first line, one up. Pranayamena yuktina sarva roga kshayo. That is very famous by many scholars in yoga. But ayuktabhyasa yogena sarva roga samudbhava. I think we must emphasize to our students and patients also that if you want to learn yoga, just don't learn yoga by reading books or just by looking at videos, but you should go to your masters, or you should be in front of your teacher, maybe even on a web video conferencing or so. But ideal would be in a physical form, because if you don't do that, then there could be problem. Next, please. Okay, one up. Previous one. Hikka श्वासश्च कासश्च शिरकर्ण अक्षिवेदना bhavanti vivida roga pavanasya prakopata. If we do pranayam in a wrong way in the sense various ways in which a person can make it wrong. Major problem which I see nowadays is in a ratio 1:1, 1:2, 1:4. Many times in the beginners we say 1:1. Then when a person gets little seasoned, then we suggest 1:4:2, right? Purak, then Kumbhak and Rechak. But then people, they just do Hevai, and that can also create a problem. So we need to be very careful while doing pranayam. We need to keep our spine erect. We need to make sure that there is no problem, no pathologies within our nostrils. If there is a DNS, or if there is a hemangioma or something of that sort, and if he is having a blowing nose, he should not do pranayam, otherwise it will harm him. So all those points we need to explain. Next, please. Okay, I think we will stop here because there are so many slides. We will not cover that. Some other time, if we get time, we can work with that. If by any chance, if someone has got any specific questions, it's most welcome, provided time is there. Or otherwise, I end up over here. If there are any queries from the student side, they can approach me on my mobile number, on my WhatsApp, or yeah. Hello.
Thank you so much, sir, for this insightful and wonderful lecture.
Thank you.
As of now, sir, there are no questions
Okay.
in the comment section. Maybe the student audience will ask in Facebook.
No. So once again, I thank Dr. Reddy sir for giving me opportunity to be in front of you. And I just wanted to give a little different orientation, because usually we see all those papers and what kind of studies which we all learn. But I wanted to pick up certain specific points in a clinical relevance. And I think we should include those in our teaching also, so that it will be helpful for all. Thank you very much.
Thank you so much, sir. Thank you.
1 minute.
Yes,
Yeah.
sir.
Only 1 or 2 comments, and I am so delighted because we have not discussed many things, but you have taken the Brahmanand Tika, and I think that means that is you are having an insight of very traditional text, and because text are one side, but their interpretation, interpretation and their tikas, etc., later part, that will give a lot of insights. So that is the thing what has been you have mentioned about it. I'm very happy.
Thank you.
Second one is we'd like to have very good even our Arpan. We are thinking about the various chakras and energies and related in our Ayurveda and yoga. So then even our Satish Pathak, the modern medical and 3-4 people, and another one I will search, will have 1 day, full day seminar on a particular topic, and with a selected yoga PG students, not just a certificate or something. It should be of the higher level. So there should be a workshop kind of thing, and then also PG students of Ayurveda who are in Swasthvrut, and many people are now taking yoga for PhD degrees. Their PhD degrees Swasthvrut. There may be some 50 to 100 students in the entire country who are doing PhD on various dimensions of yoga, clinical yoga practice. So we may collect and make it a very 1 or 2 days, very in-depth kind of Vandana. You inform it to our Lakshmi Kandan. He is doing that, and we'll take it further, because such type of detailed discussion, and especially our PG students and therapy, postgraduate diploma in yoga therapy for medicos, they should be aware of all these things. When a medical person speak about them, speak to them, and they will be more convinced that. So these are my only few remarks and how to take it forward in the due course of action. Thank you very much.
Thank you, sir. Thank you.
Thank you.
Thank you so much, sir. On behalf of Morarji Desai, the National Institute of Yoga, and my own behalf, I would extend my gratitude to you for accepting our invitation and coming to this webinar. Thank you so much. I would also like to thank Director of Morarji Desai National Institute of Yoga, Dr. Ishwar Basavaraddi, sir, who is with us besides of his busy schedule. Thank you so much, sir. And thanks to our technical team. Thanks to all the audience for joining us today. Let us end the program with prayer. Om Sarve Bhavantu Sukhinah, Sarve Santu Niramaya, Sarve Bhadrani Pashyantu, Ma Kaschit Dukh bhag bhave, ma kaschit dukh bhag bhave. Om Shanti Shanti Shanti. Thank you so much, sir. Thank you.